Between 2012 and 2016, the cost for prescription insulin has risen 700%. Soak that in for a second. 700%.
It depends a lot on your insurance.
Okay.
Essentially, doses of insulin vary, but on average, you're dealing with a cost of about $500 per month before insurance kicks in, if it kicks in.
I recently had a chance to sit down with Dr. Harold Starkman, who is not only a board member with the Diabetes Foundation, but is also director of the BD Diabetes Center at the Goryev Children's Hospital here in Morristown, and knows all too well the dangers that those with diabetes face when they don't have access to insulin.
The effects are really dramatic. Historically, type 1 diabetes before the days of insulin had a 5-year survival rate of 0. And it wasn't until Banting and Best did their thing inventing the insulin that they first were able to treat diabetes, and it was really a life-saving medication.
The disease impacts more than 1 in 10 New Jersey adults, and concerns about paying for insulin are often worrisome, which makes a recent bill approved by the Senate Commerce Committee gratifying. Now, the measure would cap patients' copay at $50 a month out of pocket for their prescription insulin and prohibit insulin coverage from being subject to any annual deductibles.
We have families that are sharing the same bottle of insulin. There have been deaths reported throughout the U.S. of people who couldn't afford insulin, and they develop ketones, they become really dehydrated, and they die. And that's happened in New Jersey as well as other places. So anything you can do that can put insulin into the hands of the people who need it is really important.
In Morristown, Phil Andrews, New Jersey News Network.